So the hematolymphoid system is really powered by hematopoietic stem cells, which are these rare cells within the bone marrow that have the capacity to self-renew for life and give rise to all sorts of different blood and immune cells. And so in Fanconi anemia, as well as other malignant and non-malignant blood and immune diseases, replacing the hematopoietic system through hematopoietic stem cell transplants is a very effective way of curing the blood and immune issues associated with those diseases. So there's two main strategies that people tend to use when trying to restore the blood and immune system that focus on the hematopoietic stem cells. The first is allogeneic stem cell transplants, where we first have to condition patients in order to be able to receive transplants from donors, and then we use healthy donors and the hematopoietic stem cells from them to then be transplanted into these patients to restore their blood and immune system. And the second strategy that we use is trying to fix patients' own hematopoietic stem cells. And the primary way that we've been doing this to date is by first taking out patients' hematopoietic stem cells, often through mobilization and apheresis, and then fixing them ex vivo, and then replacing them back into patients through a transplantation process. In most cases, we've been primarily focusing on using lentiviral vectors, although now there are newer different types of gene editing and base editing strategies that people are starting to explore as well. But primarily people are doing these all ex vivo through the manipulation of patients' own hematopoietic stem cells in a dish and then infusing them back into patients.